Administration instructions for CYANOKIT, hydroxycobalamin for injection, 5 grams. CYANOKIT is indicated for the treatment of known or suspected cyanide poisoning. If clinical suspicion of cyanide poisoning is high, CYANOKIT should be administered without delay. There are no contraindications for administering CYANOKIT in the field. Serious adverse reactions with hydroxycobalamin include allergic reactions and increases in blood pressure. Important safety information is available at the end of this video. You can view full prescribing information at CYANOKIT.com. This video includes a simulation of the preparation and administration of the CYANOKIT 5-gram vial and is intended for emergency medical personnel and first responders. In it, we'll describe the signs and symptoms of cyanide poisoning, dosing for CYANOKIT and how to administer it, as well as selected safety information. Cyanide poisoning may result from inhalation, ingestion, or dermal exposure to various cyanide-containing compounds, including smoke from closed-space fires. To learn more about cyanide and potential sources of poisoning, please visit CYANOKIT.com. Prior to administration of CYANOKIT, smoke inhalation victims should be assessed for exposure to fire or smoke in an enclosed area, presence of soot around the mouth, nose, or oropharynx, and altered mental status. Not all smoke inhalation victims will have cyanide poisoning and may present with burns, trauma, and exposure to other toxic substances, making diagnosis particularly difficult. Currently, there is no widely available rapid confirmatory cyanide blood test, so treatment decisions must be made on the basis of clinical history as well as the signs and symptoms of cyanide poisoning. Some common signs to look for include disorientation, mydriasis, and vomiting. Common symptoms of cyanide poisoning can include headache, dyspnea, and chest tightness. It is important that treatment decisions be made using appropriate medical judgment by emergency medical personnel. If clinical suspicion of cyanide poisoning is high, based on signs and symptoms, CYANOKIT should be administered without delay. There are no contraindications to administering CYANOKIT in the field. Serious adverse reactions with hydroxycobalamin include allergic reactions and increases in blood pressure. Consideration should be given to use of alternative therapies if available. Most other reported side effects from CYANOKIT were generally mild to moderate and resolved spontaneously. Please note that skin redness may last up to 2 weeks and urine coloration may last for up to 5 weeks. Comprehensive treatment of acute cyanide poisoning requires support of vital functions. CYANOKIT should be administered in conjunction with appropriate airway, ventilatory, and circulatory support. Now, let's talk about dosing for CYANOKIT. The starting dose of CYANOKIT for adults is 5 grams administered as an intravenous infusion over 15 minutes. Administration of the entire vial constitutes a complete starting dose. Depending upon the severity of the poisoning and the clinical response, a second dose of 5 grams may be administered by intravenous infusion for a total dose of 10 grams. The rate of infusion for the second dose may range from 15 minutes for patients in extremis to 2 hours as clinically indicated. Now that we've explained what to look for in a potential victim of cyanide poisoning and dosing for CYANOKIT, let's take a look at what comes in a CYANOKIT and how to administer it. Each CYANOKIT contains one 250 milliliter glass vial containing 5 grams of lyophilized hydroxycobalamin for injection, 1 sterile transfer spike, 1 sterile intravenous infusion set, 1 quick-use reference guide, 1 package insert. The recommended diluent is 0.9% sodium chloride. Lactated Ringer's injection and 5% dextrose injection have also been found to be compatible with hydroxycobalamin and may be used if 0.9% sodium chloride is not readily available. Please note that the diluent is not included in the kit. The following is a simulation of the preparation and administration of CYANOKIT performed in a controlled setting. Please be advised that in a true emergency situation, other supportive therapies may be in progress, including basic and/or advanced life support. With the 5-gram vial in an upright position, begin by reconstituting the hydroxycobalamin with 200 milliliters of diluent using the supplied sterile transfer spike. The line on the vial label represents 200 milliliters of diluent. Hold the vial level to make sure the diluent reaches the fill line. Following the addition of diluent to the lyophilized powder, the vial should be repeatedly inverted or rocked, not shaken, for at least 60 seconds prior to infusion. The hydroxycobalamin solution should be visually inspected for particulate matter and color prior to administration. If the reconstituted solution is not dark red, or if particulate matter is seen after the solution has been appropriately mixed, the solution should be discarded. The solution is now ready to be infused. Using the supplied vented intravenous tubing, hang and infuse over 15 minutes. Because there are a number of drugs and blood products that are incompatible with CYANOKIT, it requires a separate intravenous line for administration. Hopefully you've learned what to look for in a potential case of cyanide poisoning and how to treat it with CYANOKIT. Now, here is some safety information you should keep in mind. Caution should be exercised when administering other cyanide antidotes simultaneously with CYANOKIT, as safety has not been established. If a decision is made to administer another cyanide antidote with CYANOKIT, these drugs should not be administered concurrently in the same IV line. CYANOKIT also has certain incompatibility issues that should be recognized for safe administration. It is incompatible with select drugs used in resuscitation efforts, with sodium thiosulfate and sodium nitrite, and with ascorbic acid. Administration of blood products through the same line is also not recommended. Because of its deep red color, hydroxycobalamin may cause hemodialysis machines to shut down due to an erroneous detection of a blood leak. This should be considered before hemodialysis is initiated in patients treated with hydroxycobalamin. Use caution in the management of patients with known anaphylactic reactions to hydroxycobalamin or cyanocobalamin. Consideration should be given to use of alternative therapies if available. Allergic reactions may include anaphylaxis, chest tightness, edema, urticaria, pruritus, dyspnea, and rash. Allergic reactions including angioneurotic edema have also been reported in post-marketing experience. Substantial increases in blood pressure may occur following CYANOKIT therapy. Elevations in blood pressure, greater than or equal to 180 millimeters mercury systolic, or greater than or equal to 110 millimeters mercury diastolic, were observed in approximately 18% of healthy subjects receiving hydroxycobalamin 5 grams and 28% of subjects receiving 10 grams. The most common adverse reactions, greater than 5%, included transient chromaturia, erythema, rash, predominantly acneiform, increased blood pressure, nausea, headache, decreased lymphocyte percentage, and injection site reactions. CYANOKIT should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. The safety and effectiveness of CYANOKIT in pediatric patients have not been established. In general, the safety and effectiveness of hydroxycobalamin in elderly patients was similar to that of younger patients. No adjustment of dose is required in elderly patients. No data are available about overdose with CYANOKIT in adults. Should overdose occur, treatment should be directed to the management of symptoms. CYANOKIT should be stored at 77 degrees Fahrenheit, with excursions permitted from 59 degrees to 86 degrees Fahrenheit. It may be exposed during short periods to temperature variations of usual transport, transport in the desert, and freezing or defrosting cycles. Once reconstituted, hydroxycobalamin is stable for up to 6 hours at temperatures not exceeding 104 degrees Fahrenheit. Do not freeze the reconstituted solution. Any reconstituted product not used in 6 hours should be discarded. Please keep watching for important safety information on CYANOKIT. Indication: CYANOKIT, hydroxycobalamin for injection, 5 grams, for intravenous infusion is indicated for the treatment of known or suspected cyanide poisoning. If clinical suspicion of cyanide poisoning is high, CYANOKIT should be administered without delay. Important safety information: cyanide poisoning may result from inhalation, ingestion, or dermal exposure. Prior to administration of CYANOKIT, smoke inhalation victims should be assessed for exposure to fire or smoke in an enclosed area, presence of soot around the mouth, nose, or oropharynx, and altered mental status. In addition to CYANOKIT, treatment of cyanide poisoning must include immediate attention to airway patency, adequacy of oxygenation and hydration, cardiovascular support, and management of any seizure activity. Use caution in the management of patients with known anaphylactic reactions to hydroxycobalamin or cyanocobalamin. Consideration should be given to use of alternative therapies if available. Allergic reactions may include anaphylaxis, chest tightness, edema, urticaria, pruritus, dyspnea, and rash. Allergic reactions including angioneurotic edema have also been reported in post-marketing experience. Substantial increases in blood pressure may occur following CYANOKIT therapy. Elevations in blood pressure, greater than or equal to 180 millimeters mercury systolic, or greater than or equal to 110 millimeters mercury diastolic, were observed in approximately 18% of healthy subjects receiving hydroxycobalamin 5 grams and 28% of subjects receiving 10 grams. Usage may interfere with some clinical laboratory evaluations. Also, because of its deep red color, hydroxycobalamin may cause hemodialysis machines to shut down due to an erroneous detection of a blood leak. This should be considered before hemodialysis is initiated in patients treated with hydroxycobalamin. Due to potential photosensitivity, patients should avoid direct sun until erythema resolves. There are no adequate and well-controlled studies of CYANOKIT in pregnant women. CYANOKIT should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Safety and effectiveness of CYANOKIT have not been established in pediatric patients. The most common adverse reactions, greater than 5%, included transient chromaturia, erythema, rash, predominantly acneiform, increased blood pressure, nausea, headache, decreased lymphocyte percentage, and injection site reactions. View the full prescribing information for CYANOKIT at cyanokit.com. For medical questions concerning Meridian products, to report an adverse event, or to speak to a member of Pfizer U.S. Medical Information, please call 1-800-438-1985. To order CYANOKIT or to request additional training materials, please call a Meridian representative or visit cyanokit.com.